Welcome, and thanks for joining me on today's talk about sciatica. So my name is Nathan Miller. I have my doctorate in physical therapy, and I'm an athletic trainer. I also run Shield PT and injury prevention right here in Fort Wayne. And so today's topic is it possible to get rid of sciatica for good without painkillers, injections, or surgery? Now, I've been working for over a decade with people on these type of injuries, helping them overcome them, and I want to give you everything I've learned to help you make the best decision to see if you're somebody that would be able to overcome these pains, even if you have a diagnosis of a herniated disc, arthritis, impingement, labral tear, any type of sciatica. And so that's what we're going to talk about. But at the end, I also have an ebook that I'd like to send you. And so that's about how to ease your back pain. And there's another offer I want to make, which is going to be a guarantee that will help you with your back pain. And if you're willing to take that, I will tell you all about the details, but you got to stick around till the end. So let's jump into it here. And what are we going to cover today? So quick overview. We're going to talk about what is sciatica. I know it can be kind of confusing. We've heard different things. People say different things on, oh, that's my sciatic pain. Okay, is it not? And what causes sciatica? We're not only going to talk about what most people say causes sciatica, but what is actually true of what can cause sciatica. And then we're going to talk about how to fix that sciatica as well. And by the end, we even have one video we're going to cover real quick on something you can start doing to address your pain today. And then we'll talk about that special offer with the guarantee. So, what kind of problems do people have when they have sciatica? It's all, I mean, it can be many things, but it's pain, numbness, tingling, starting in your back, maybe not in your back, in your buttocks, down your leg, and it's related to sitting. It can be worse with sitting. It can be better with sitting. It can be worse with standing. It can be better with standing. Walking. Sometimes people say, man, I can't even walk through the grocery store because my pain gets so bad. Sleeping becomes very uncomfortable, and for most people that are dealing with this, exercise is out of the question. And so then they end up gaining weight. They end up losing the muscle that they have, and they become feeling like they're old. And really, that's not the only fear. The fear that something worse has happened. I'm going to need surgery. I'm never going to be the same again. And the question that most people I run into ask is life ever going to get back to normal? And so we want to talk about that. But let's talk through the anatomy of it. So I'm going to hide my face for just a second, and I'm going to play this video. Okay, so let's talk through the anatomy here. We're looking at a man or a woman, I don't know, and there's their bones and nerves is all we have on here right now. So as we dive into the low back, obviously the white is the bone, the yellow is signifying a nerve, and so this is your L5 vertebrae, L4 vertebrae. L just means lumbar. It just tells us which one there is. And then the nerves coming out are also associated with it. So L4 nerve, L5 nerve. And so the sciatic nerve is right here. It actually doesn't form into the actual sciatic nerve until way down here in the buttocks. But it's made up of your L4, your L5, your S1, S2, and S3 nerves. They all come together to make your sciatic nerve. But talking through the anatomy here, so there is this space here. It's not showing right now, but there's a disc in there that separates, and it's kind of fluid filled on the inside. It allows for absorption of impact, allows you to bend, and it can get a herniation. And so most people know that herniations are what everyone says is the main cause of sciatica. And actually, we will talk about that. Just because you have a herniation does not mean that you have symptoms. But I'll prove that to you later. But this disc here, think of it like a jelly donut. It's not a perfect analogy, but a lot of people use it. And the inside is, I said fluid, but it's not like a fluid. It's more like a gel. And if it tears from an injury or whatever, it can push back on the nerve, and that can give you compression on the nerve. Compression of the nerve leads to symptoms like numbness or tingling or pain. It could be sharp pain, it could be an ache. You can even get coldness and lack of strength. All of that can be affected and related to sciatica. But this is the first site where it could occur. Where else could that occur? So, oops, I'm still figuring out this anatomy app. Well, let's just follow these nerves down. So they go through the buttocks. There's a lot of muscles there. I'll show you that in a minute. Comes down the back of the leg. And if we add a little bit more nerve, don't want to complicate it too much, but the sciatic nerve comes down and look at splits into two parts. One goes down more the outside of the leg, one goes down more the back and to the foot. And so if we even look here, There's nerves on the top of the foot, around the back of the foot. All of that is coming from your sciatic. I would say 2/3 ish of the lower body is being controlled by these sciatic nerves. Sorry, I'm all over the place. Let's try that again. So as we look at it here, let's start adding some muscles. And we have all these muscles. Obviously, your body isn't pulled apart like this. It's all here. But let's pick out this one in particular because it becomes a problem. If you've heard of it, it's the piriformis muscle, and it runs really close there to the sciatic nerve, as you can see. So if we have an irritated muscle, it's going to irritate that nerve. If you have a really tight muscle, it will irritate the nerve. Very much the same as that disc in the low back causing problems. And in my experience, this is actually a much more common problem than the herniated disc causing the pain. But that's not the only one. The piriformis is a common one. You have your obturator, which lives right here on the other side of it. This one, or this one, those could be part of it. That's the gemellus. And then you have your hamstring tendons that live in through here. And if we add even more muscles, you have your glutes. So your big glute muscle lives right over the top of it. And so any of those muscles being too tight or too weak or overused can lead to a sciatic type pain, irritating it. And so what can we do about that? Okay, so hopefully that made sense. I'm going to add my face back in here. Bring it down here. We'll hit up the next slide. So that's the anatomy. If they do an MRI or an X-ray on you, what things could show up or have shown up? Many of you have probably heard these terms before. Let's talk about them. So DDD, degenerative disc disease, arthritis, which is very much associated with that, DDD, herniated discs, and spinal stenosis. So talking through over here, so this first one is a normal disc. It's plush, it's nice, it's soft, it absorbs the impact well, and that's what teenagers have. The degenerative disc has lost some of its height. It's no longer as strong. It's just not good like it once was. The bulging disc is where it starts getting a little bit of a tear. I said in that video, it tears. You might have, I didn't speak clearly. It wasn't really that the gel on the inside was tearing. It's the outside fibrous portion that could tear. And it's starting to here. It's bulging out. Herniation is a bigger version of that, basically where it actually does tear and the inside gel type stuff moves out to the outside. And they classify that with different things, including a protrusion, which we'll talk about in a minute on the next slide. But the question is, all right, so if this stuff shows up on your X-ray or MRI, is it a problem or is this a normal part of aging? And let's discuss that. So here's a compilation of a bunch of studies where they looked at all these people that have had problems. And so, or that didn't have problems, sorry, I misspoke. So this is 1,200 people. Let's talk about the neck first. 1,200 people that didn't have any symptoms at all. And almost 90%, 87.6% of them had a disc bulge, including even people in their 20s, 3/4 of them. So it's a very normal thing. I said teenagers have that nice discs, but some of them I'm sure are going away too. Now, this isn't just associated with the spine. So these are your neck, but we also have a structure in the shoulder, a structure in the hip, and a structure in the knee that all have things show up, with nearly 43 out of 44. So over 50% of all these structures in people that don't have any symptoms, no pain, no weakness, no numbness, and they're having these symptoms. So how can that be? But let's dive into the one that you have the most questions with, I imagine, the low back, right? So there's a study from 2014 where 3,100 people had no symptoms at all, and yet 50% of them had disc degeneration, DDD. So if they went in and told their doctor and said, hey, my back hurts, they'd get an X-ray and they'd get a diagnosis of DDD, but their back didn't hurt. So how do we explain that? And the other thing was 36% of them had a disc protrusion. I'm not trying to get, the terms can be confusing, but that's a herniation. And it's actually a pretty severe herniation. So over a third of them had a severe herniation. It's kind of what this MRI is showing, that the disc is right there. It's pushing out this way into, that's where your nerves come out along there. And so it's likely impacting it from what we can see on the MRI. However, a third of them that didn't have any symptoms had that going on. So is this just a normal part of life? That's the question. But my key point that I want to make is just that you can't see pain. This is going to show up the same way on people that don't have pain as people that do have pain. And so what's the difference? Is that the cause of the pain? Sometimes it is, but many times the actual thing that shows up on the MRI is not the source of the pain. And so let's talk through that a little more. So how do we figure it out in our clinic? I use the term rule out by ruling in. So we're going to rule out that the problem is what showed up on your x-ray or MRI if we can rule in a better cause, a more complete cause. So think of it this way. If you come in and you have degenerative disc disease or you have a herniation, and I can change your pain with some sort of a movement or an exercise, or with some sort of a massage or other hands-on technique that I do, then it's a very low likelihood that that pain that you were feeling is from the disc herniation or the degenerative disc disease, because a massage is not going to change arthritis. A stretch or a movement is not going to change degenerative disc disease. But what we can change is a bunch of other things. And so that's what I want to talk to you about. Do that. So we use a 3-step process because step 1, you come in, you're in pain. We want to get you out of pain as quick as possible. So pain relief is step 1, but you don't want to just put a Band-Aid on this and wait for it to come back in a couple months. I know that you want to get to the root cause of it. And so do we. We specialize really in finding and addressing the root cause. And that's with a very good, thorough evaluation to figure out what deficits you have, and then providing you with a specific intervention that's not cookie cutter, but individualized to each of our clients. And we pride ourselves on spending as much time as anyone in town one-on-one with your doctor of physical therapy with you to address your problems. And then step 3 is where our clients are like, man, I'm feeling so much better. I'm beyond baseline. I'm stronger than I was before. And they just want to be able to be independent with their maintenance. Hey, I want to be able to do this, just continue to stay strong. And I want to go run. I've never been a runner before, but I want to run, or I want to climb, or I want to lift heavier weights than I've ever done before. And we help people do that as well. But the step 1 with the pain relief. So talking through that, what things give pain relief? It's not high-level exercises. It's not lifting heavy weights and running. That's rarely going to give people pain relief. Usually it's stretching and hands-on techniques like massage, dry needling. If you're not familiar with that, it's similar to acupuncture, but we only do that on people that want it. And it does give people relief. But you may say, hey, I've stretched a lot and I didn't get any pain relief. I got massages and it helped a little, or it only helped for a short period of time. Well, I would say we really need to make sure that we're not only getting the right technique, but addressing the exact problem that you have at the same time. So it's not about the technique. It's about the person giving the technique knowing how to apply it to your specific injury. And that's where that really good thorough assessment and then continuation with your physical therapist, not being passed off to somebody else, but a PT that can continue to address you, continue to evaluate you as you change, so that each time you come in, you're updating your exercises and make progress to the next level. That's how we get you not just from pain relief. Because if you just wanted pain relief, you could put ice on it. You could take some ibuprofen and you would get a little bit of pain relief, but I don't think that's what you're wanting. I think you want to get to the root cause. Most of the people that are serious about this want to get to the root cause so they can get back to doing the things that they love. And so that's where step 2 is. And it's about fixing the movement problem. If you have pain with walking, or if you have pain with sitting or standing, these different movements, these different positions, and moving from position to position causes pain or relieves pain, then that's a movement problem. And so, especially even pain with sleeping, you say, oh, I'm sleeping. Well, you are moving a little bit. You're right. You're mostly still, but it's that positional change that causes people problems. And so we can sum it all up with almost all of our pain is caused because the area is overworked, because it's compensating for somewhere else that's stiff or weak. And essentially that's what we look at our evaluation, is really figuring out. So here I'm working with my client trying to figure out, how are you bending? How are you moving? So that we know what is stiff and what is weak. And we're going to look at that globally, look at your whole body first, and then dial it in specifically to different joints. So yeah, I maybe got ahead of myself a little bit, but we're looking at it from a stability and mobility standpoint. So let's talk about walking. As you walk, different joints have different jobs. And so your foot needs to be stable. It needs to hold your weight, but your ankle needs to move as you rotate over the top of it. Your knee needs to be still, and your hip needs to move. If your knee buckles, you got a problem when you're walking. But if your hip isn't moving, you also have a problem. So the low back needs to be stiff, the hip needs to be mobile. But the problem is, a lot of times people come in and something there is wrong, and it could be the mid back is it's supposed to be mobile, but it's stiff. And so then your low back is having to make up for that, and it's moving too much, and it gets irritated. An analogy I use is if you run a group project at work or in school, and you have somebody that's not pulling their weight. Well, now you have to work extra. You have to spend longer hours at work. You have to work on the weekends or whatever. And eventually you're going to get irritated. You're going to get upset that they're not pulling their weight, and it leads to pain. Well, the same is true in our body. And so, that's something that we really find and address is that's our first job, finding the mobility issues. Next, we find the stability issues. So if you have certain muscles that are weak, that's where we work on addressing the long term, keeping this from coming back. And again, the key is everyone's different. I can't just tell you these are your top exercises. I mean, if you look on YouTube, there's always the top 5 exercises, and I'm guilty of that. I've made a few of those videos too. But the reality is we can't just say cookie cutter, this is the best exercise, because it's going to be different based on what your body needs. Maybe from a previous injury or a previous sport or activity that you did that made you extra mobile in this area, or extra tight in this area, or strong over here and weak over here. And oftentimes it surprises people when they come in, the things that we find. So let's talk through what is required as you bend. So your hips, both hips, need to be able to move. They need to go forward and backward. That's flexion and extension. Then we have out, abduction. That's the third motion. Adduction. That's the fourth motion. And then we have internal rotation, fifth motion, and external rotation, the sixth motion. So 6 degrees of motion for your left, 6 directions, I should say, of motion on the right. And then it also goes in with the spine. So as your low back bends forward, that's called flexion. And as you bend backwards, that's called extension. So that's 1, 2. And then bending to the side, right side is 3, left side is 4. As you rotate left, that's 5. As you rotate right, that's 6. And so all 6 motions are required for your low back to move well. But if the hip isn't doing what it should, let's say the left hip is lacking internal rotation, then your right, then your low back has to make up for it, or your right hip is going to try to make up for it, and something leads to breakdown. And oftentimes it's those muscles that get overworked and irritated. So now let's look at, I'm just going to describe how they work together. So as I'm here, I bend forward. Sorry, I was trying to get that off. Okay, so I bend forward. My low back rounds, that's flexion. My hip is flexed, and I have to shift my weight backwards so I don't fall on my head. So there's a weight shift there too. So those are working together. As I bend backwards, now my hip has to extend, my low back has to extend, and I have to work on my balance too. Now I'm twisting, and so here, my right hip has to internally rotate as my left hip has to externally rotate. Same thing in my ankle. My ankle has to internally rotate and my left has to externally rotate. And then my spine is right rotating. And so if any of those motions, now the ankles are less common, the hips are really where we find the most problem, which is why here in a minute I'm going to give you a hip exercise. But if those are not working like they should, then the low back has too much motion, and it leads to pain. If you go the other way, same thing. This side has to internally rotate, this side has to externally rotate at the ankle, at the hip, and then your low back has to rotate on top of it. And if any of those aren't working well, then something else is going to try to make up for it and it'll lead to pain. And then lastly, squat, this isn't last. Pause. So if we're down here at the bottom, for a deep squat, my low back is rounding, my hip is coming to full flexion, my knees are coming to full flexion, and my ankles are coming to what's called dorsiflexion, which is basically toes up to your shins. And so if all of those motions are not working like they should, then something is going to cause pain. And so if you get pain with squatting down, oftentimes it could be a knee, an ankle, a hip issue rather than your low back, which is where you feel the pain or you feel in the hip. And then single leg stance, I require stability, at my ankle, at my knee, at my hip, and at my low back. And I need to work on my balance. So all of those are required for just some simple tasks. And when you come in, that's one of the very first things that we evaluate is those motions, full body, toe touch, back bend, rotation, squat, and single leg balance. And it gives us a ton of information so that then when we jump into, gives us a ton of information so that then when we jump into the actual, more specific part of the exam, we already know, okay, we need to really dive into this area, and this is what I'm expecting, but it's either this or this based off of how they stood and twisted. All right, so I'm going to show you, I'll hide my face for a second. I'm going to show you a quick video that is an exercise, an activity that you can start doing for yourself. So you take a lacrosse ball. If you don't have that, a tennis ball works okay, but it's not as aggressive. A baseball would work good too.
Lacrosse ball on the outside of the hip. You're going to take the ball, pin it between you and the wall, and you're looking for those sore spots. So you lean into it. I'm kind of taking some weight off of that leg that's against the wall so that most of my weight is on this other leg and then lean into the ball. And so then I go until I find a sore spot. I hold that pressure for 20 or 30 seconds, try to get it to release a little bit, and then move on to the next spot. Most people find that doing this for 3 to 5 minutes per day helps to really alleviate that tension a lot.
Hopefully that'll be helpful to get you started. But again, that's just part of phase one, getting you out of pain. That might be more effective for some people. It is more effective than ice or more effective than ibuprofen. So give that a try. If you have questions with it, that wasn't super detailed. I usually give that video only after I've explained it in person to someone. So feel free to reach out if you have questions about it. But my offer for you is that you can have a specialized PT sciatica assessment with me. So we would start with, it would just be $49. Now, normally these are $250. $49 is the lowest that we've offered it for. But if you've spent the time to go ahead and listen to this video, then I feel like you're probably very motivated. And what that would look like would be like a 50 to 60 minute appointment with me. We'll spend an hour really trying to diagnose the root cause of your pain. And then I will give you some sort of a pain relieving treatment that first day. Now, depending on the person, sometimes that's hands-on treatments, or I'll let you decide if you'd rather get the exercises that you do at home. We can't usually do both that first day. But I mentioned that there's a guarantee with this. And so my guarantee is that if you feel like this appointment was a waste, you come in, you pay us your $49, I'll not only just give you that $49 back, but I'll give you another $49 for your time if this was a waste of your time. Because I'm so confident that if you've listened to this and you feel like what we do is helpful, that it won't be a waste of your time and that we'll find something that will give you relief and hopefully even map out a plan to get you full relief. Now, with that being said, I have a pretty busy schedule, and so we only have about 10 openings for this at this moment. And so we would love for you to reach out, and hopefully we can get one of those so that we can get you some relief. So the last thing I want to show you, again, I'll hide my face, is this is one of our clients. Her name is Abby, and she's going to tell her story real quick of what her experience working with Shield PT was.
Hi, Abby.
Hi.
Thanks for being willing to do this. We just wanted to kind of
explain your experience working with Shield PT.
Okay.
And so I've got some questions to ask you, and thanks for being willing to share with other people that might have similar issues. So think back before you ever came to see us. How long were you dealing with this, thinking about making the decision?
Yeah, I've dealt with back pain since I would say probably 6 or 7 years, and really since the time I saw your ad to when I called, it was really only a few weeks. And I would say, my only hesitation was I'd had a couple bad experiences in the past, so that was my real hold up, but I'm glad I did. So
okay. Yes. So why did you feel as though you had to wait that long? Was it those
well,
bad
like
experiences?
I said, I had some bad experiences, and I don't want to say bad, just unsuccessful.
Okay.
Really. Yeah, I had been to some physical therapy before, and it just didn't work out. And I even, tried injections and chiropractors and all those kinds of things, and it just wasn't doing what I needed. So.
Okay. So about your problem, can you
Yes.
kind of explain what it was?
So I would say my main issue was my right hip, really deep into my hip joint, and then my outer hip muscle, and then my lower right back section. Just pain mostly from when I had to sit too long or stand in one place too long, especially sleeping. That was really, really a painful experience. So, that's what I really needed to focus on.
Okay. Were you missing out on anything because of this pain?
Definitely. I have a 2-year-old and a 7-year-old, and so extremely active, and I feel like I couldn't get on the floor with them and play with them and run and ride bikes and even go for long walks. So I felt like I was definitely missing out.
Yeah. I remember one of the first questions we asked you was what's your motivation to get this better? And you put names. I'm like,
Yeah.
I bet those are her kids. So you said you tried chiropractic, massage.
Yeah.
What other things have you?
And like I said, I tried injections too, and I would get some relief from that, but not lasting.
Okay.
And it just wasn't, realistic things that I could maintain at home. So, so I was really looking for something that would, get me some lasting relief and something that I could do on my own after we were done.
Okay. Yeah. So you said you've done physical therapy before this, and then versus now. Were there any differences between? Or what were some differences between what you did now and then this time?
I really like that this is more individual attention, and from the minute I came, there was this assessment of my issues, and a plan was created, which I appreciated. Whereas before it was what's your problem, and then do this, do this, do this, and there was no end goal or time frame put on it. So I just really appreciate that you took the time to listen to what my problem was and put a plan together to fix it. And what you said would happen happened. So I'm a believer.
Okay, awesome, love it. Okay, so now that you've been through and experienced it, if your friend or family member had pain and they were just kind of like, I don't know, should I go see a chiropractor? Do I need to talk to a surgeon? Do I need an MRI? What would be your advice to them?
I would definitely say come in and at least get an assessment, and see what kind of plan you could put together for them. Because it's worth it. It's an investment in time, but with the tools that I have now and the knowledge I have now, I feel like it's something I can continue on myself. So I would definitely suggest it.
Yeah, I love that. So all the things that you enjoyed coming in, I mean, there was so much fun when you came in here. What was the thing you liked the best?
I would say really the take-home information, because I'm a busy single mom of 2 kids, and you seem to understand that I needed things that would be done quickly, and that I could just do kind of between things I was doing at home. So I really appreciated that individual plan that you put together for me specifically.
Okay, yeah, and then so thinking back to when you first came in, that right hip pain and all that. What was the number one thing that you wanted to achieve, and did you achieve it?
Sleeping. I want to be able to sleep, yes, because that's the most important, to get all those other things done. So yes, I can comfortably sleep now, and I do some stretching before I go to bed and when I wake up, and I can get better sleep, and that's what was important. So
okay, love it. Well, thank you very much. I really appreciate
Thank
it,
you.
and hopefully this will help other people that
Yeah,
are
I hope so.
in your
Do
spot. So.
Yeah.
Thanks.
All right.
So hopefully you can be the next Abby, and you can have success like she did, be feeling much better. Turn this back on for the last second. So in order to move forward, feel free you can claim that $49 evaluation by texting sciatica to this number, and I'll get on a phone call with you, and we can talk about
what it is that you have going on, make sure that I think I can help you. And if so, then we'll bring you in for that evaluation. If you're not ready for that, you can also just text it and we'll send you that ebook that I was talking about. But I think to get you that guarantee, I would love for you to be one of the evaluations that we come in and check it out. So that's it. And thank you for listening.